right, hello South Texas, and Happy New Year. You know, I cannot believe that fiscal year 2019 is already over, and we are in the beginnings of fiscal year 2020. But, before we talk about fiscal year 2020, I really want to spend a little bit of time going over what we accomplished as a healthcare system during fiscal year 2019, and then we'll talk a little bit more about fiscal year 20 and some of the continued changes that you can expect to see in the healthcare system this fiscal year. So one of the things that I told you in my second quarter message is that as a healthcare system, we continue to grow. And I can absolutely assure you that continues to be the case. So I've got a few data points I want to give you just to put this into perspective. If you look at the Veterans Health Administration over the last 2 years, it has seen an increase of 2.2% in the number of veterans served, 2.2%. South Texas, 8.5% in the past 2 years. 8.5% relative to 2.2%. Obviously, you can see we are outpacing the nation in new veteran growth. We also hit an important milestone for the healthcare system in fiscal year 2019, and that is the 100,000 veteran mark. So we have officially seen 100,000 veterans as a healthcare system. Again, just reflective of our continued growth. Outpatient visits, really very similar data points. The nation has seen a 4.5% increase in new veterans and outpatient visits. We here in South Texas are looking at 11%. Another interesting data point I'll share with you is the percentage of women veterans. So at the national level, about 10.8% of the veterans that are currently being served are women. Here in South Texas, we're at 17.5%. So again, significantly outpacing the national average, and we're continuing to do what we need to do to meet the needs of not just our overall growing veteran population, but our growing women veteran population as well. So because of that growth, we are continuing to expand as a healthcare system, both in our physical footprint and staffing. So if you look at that same 2-year window as a healthcare system, we've increased by roughly 12% of our total staffing. So we're at roughly 4,200 cumulative FTE, non-cum closer to 4,300. Again, a similar growth in two particular occupations that we track pretty closely that we think are reflective of the overall workforce. That's RNs and MDs on staff, both of which have also seen 12% increases in staffing over the last 2 years. So again, continuing to reinforce our ranks to ensure that we can take care of the new veterans that we're receiving in the healthcare system on a daily, weekly, and monthly basis. So other important highlight that I want to be certain that you're aware of, if you have somehow missed the news, the South Texas Veterans Healthcare System is officially a 4-star facility. This is according to VHA's SAIL model and the third quarter data that was just released. So please give yourself a round of applause. That is a significant achievement. I really want to give a special thanks to our SAIL champions who have helped lead this charge for us. And it is a specifically important milestone on our high reliability journey, where we've indicated that we are going to be a top provider of safe, effective, and efficient care. And we also committed to a 5-star quality designation in the next 5 quarters. So getting from 3 to 4 stars lets us know we are absolutely headed in the right direction. Some specific domains I want to highlight. If you are not aware, the SAIL performance system has 10 domains in it, and each of those domains has more performance measures within it. But of those 10 domains, the South Texas Veterans Healthcare System has seen absolute improvement in 5 of them. That is our adjusted length of stay, our avoidable adverse events, performance measures, patient safety, and care transitions. So not only is it outstanding that in half of the domains we've seen absolute improvement from a year ago, but each one of these domains we've identified specific measures that we thought were critical to our high reliability commitment. So again, not only are we seeing improvement, but we're seeing improvement in the areas that we absolutely said we were going to improve. So again, give yourself a round of applause. This is great, but it is the beginning of our journey to 5 stars. So we'll talk a little bit more about high reliability. You should have seen my commitment of the organization in July to our high reliability journey. And if you did not get the opportunity to see that, again, for VHA and for South Texas, high reliability means that we are committing to 0 harm and an unmatched experience. So here in South Texas, we've really broken that into 3 value streams, focusing on safety, quality, and experience, and the foundational elements being leadership commitment, creating a culture of safety, and continuous process improvement. So Absolutely. Do we have leadership commitment? I committed the organization to it. Many of you have had the opportunity to hear me speak about high reliability and just culture and the variety of trainings that we've put on. But I want to talk a little bit more about some of the changes that we did deploy in FY19 as part of our commitment to high reliability, but then also share with you some changes you should expect to see going forward in fiscal year 20. So in fiscal year 19, we did a variety of things related to high reliability. This started with just culture training. I'm proud to say that 36% of our staff, so nearly 1,500 employees, have been through just culture training. That's huge. We have a long way to go, but I've been absolutely ecstatic about the engagement that I've seen from leaders and from staff. So if you had not had the opportunity to go to Just Culture Training, I encourage you to do that. I will assure you it is both life and career changing. So please take advantage of that opportunity. We also implemented Lean Daily Management Huddles. So this should have hit all of you in your work areas where you're huddling on a daily basis with your team. And you're talking about things like safety, right? Are there any safety concerns that you all have that you can work as a team to resolve at your level, or to elevate those in the organization to higher level huddles where they can provide some of the resources that you may not have at your level? In those huddles, you should also be talking about methods, which is another way of talking about processes, and processes that you think are broken or vulnerable that you as a team or that we as an organization need to focus on. In those huddles, you'd also be talking about equipment or supplies or staffing challenges that you have, again with the primary impetus of trying to resolve as many of those concerns at the lowest levels of the organization as possible. And if you can't resolve them, then you elevate those to the other huddles that are happening around you. Critical to our journey to high reliability, and critical that you and your leadership engage. So if you haven't heard of Lean Daily Management Huddles, if you haven't started them in your area, I absolutely encourage you, whether you're a manager or a frontline employee, to get with your teams, get with our systems engineering service, and we will be glad to get you started. So in FY19, we also started our very first safety forums. These are really great meetings that are generally run by patient safety or quality management or quality safety value as an entity. And we have an opportunity to talk to our staff about root cause analyses and other near misses that we've had in the organization, so that we can continue to cross-fertilize and share safety lessons to continue to make the organization safe. We do these at least once a month, if not twice a month. So if you haven't had the opportunity to participate, please do. I actually provide lunch in the safety forums as well, so you don't have to make that difficult choice between coming to talk to us about how to keep the organization safe or missing lunch. So please join us. One of the other major changes that we made during fiscal year 19 related to high reliability was the implementation of We Care rounds. So this started with myself and the senior leadership team rounding through the organization, talking with both veterans and staff, again, asking about safety, asking whether or not staff have the supplies and equipment that they need to do their jobs, asking if there's anything else I think we need to know, asking if they have members of their team that they think warrant recognition. So I've really enjoyed my conversations with staff and veterans on the We Care rounds. And so we're going to be making some changes with We Care rounds going into fiscal year 20, where it will be a senior leadership member and leadership at the service level, and continue to move We Care rounds lower in the organization and leadership structure. So look forward to seeing that. So what else can you expect to see in fiscal year 20 related to our high reliability journey? Well, I'll tell you, one of the things we're going to start doing is just taking a look at some of the performance-based incentives that we have in the organization, and trying to ensure that what we're saying is important is matching what we're paying for. So I think a basic example of that would be pay for performance. This is something that we use for primarily physicians in the organization, and we're going to change what we're looking at there. We want to incentivize behaviors that we think are both good for the individual to build skills and competency, but also are going to help the organization move towards high reliability. So some of the changes that our physicians should expect to see in their pay for performance will be incentivizing their participation in clinical team training, incentivizing their participation in joint culture training, incentivizing participation in root cause analyses, or getting a lean, green, yellow, or black belt. And we're going to be making similar changes in supervisory performance contracts. But in fiscal year 20, we really want to start with basic expectations to help us build a just culture. So we are going to be incorporating some expectations that a greater percentage of staff attend the just culture training and go through clinical teams training. So for those managers who will be impacted by those changes, you will hear about that from your service chief. We're also going to be rolling out what we're calling the South Texas High Reliability Dashboard. So these are going to be some key performance indicators focusing on quality, safety, and experience. And we're going to be displaying this information throughout the organization. You'll see some of it on our intranet homepage. But thanks to Public Affairs, you should see what I call snap frames. So they're these large frames that are really intended for us to display large posters and be able to put them up and take them down really quickly. So you're going to start to see these around the organization. And they're going to be talking about high reliability and basic principles of high reliability. But you'll also see some of this key performance data like infection rates from CLABSI and CAUTI to other hospital-acquired infections, to our mortality rates, to patient satisfaction and employee satisfaction data, and also things like what our staff tell us about their perception of safety in the organization. We're going to become much more transparent with our data. So look forward to seeing those across the organization. And when you do, if you have questions, send me a speak to the director. I'd love to answer them for you. We're also going to continue lean management trainings. I was really excited. We just published a new Greenbelt class, and it filled up very quickly. So we're going to have more offerings so that we can get more of our staff on board and help us with the continuous process improvement aspect of our high reliability journey. Last but not least, it's both linked to high reliability and my 180-day plan. We talked about developing a leadership development program in the organization for existing leaders and for aspiring leaders. I'm really proud of what our nursing service put together. It looks like an excellent curriculum. Rather than rolling that out to all managers in fiscal year 20, we're going to start by focusing on some of those areas that were most challenged in our all-employer survey and with their best place to work scores. So for those areas and managers that will be impacted by that, you'll be hearing from us shortly. I'll also give you a brief update in our experience office. I'm just ecstatic with the improvements and changes that I see happening under our experience office led by our Chief Experience Officer, Trish Lottie. So the foundation for that service continues to be laid from recruitments for the service chief for the Organizational Excellence Service to new announcements that you'll see here soon for additional ambassadors, Red Coat ambassadors, that we're going to be deploying at every campus across the South Texas Veterans Healthcare System. Lots of changes underfoot. I look forward to seeing those likely closer to the start of the new calendar year, but they're doing some great things. I think you'll all see that as well. Also want to remind you that the all-employee survey results were released. Those came out in August. You can access them from our homepage. If you have not done so, I encourage you to do so. As I've told you before, South Texas continues to do well in the all-employee survey, looking at especially best place to work indicators. But I know we could do better. But the only way we're going to do that is if we all engage in the process from a staff to a manager level, look at the results, take them seriously, get our service level work groups together, and get to work on improving the environment. We're also going to be putting together larger organizational work groups focusing on the 4 areas that our staff told us were most important to them across the healthcare system. So that included communication, accountability, professional growth, and workload. So look for those invites to come out in the next month or so. If you'd like to participate on those organizational work groups, please do. I would absolutely love to have you participate and like to see you there. Other changes that we're making in the organization related to in the experience of both staff and veterans. I'm just overjoyed with some things that engineering has already started. Some of you have maybe seen them. If not, I encourage you to start walking around and taking a look. So this includes some halls and walls projects. We had a test area that occurred just outside of the existing eligibility office on the first floor. If you haven't seen that, go down to the first floor, look right outside the eligibility office, and look at some of the new paint work and floors that our engineering staff have installed. Done a very good job. You're going to start seeing more of that around the organization. We're also going to be doing some restroom renovations. That's thanks to some of your feedback. I know we sent out about environmental management service and some improvements we can make. A lot of comments there on bathrooms. So kudos to EMS and engineering for getting to work. And you'll see some of those improvements very soon. And if you like what you see, please thank EMS and thank engineering for jumping in and taking that bull by the horns. We're also going to be making a new welcome center. Thank you to nursing and their flexibility. We found a new home for nursing administration. That's going to allow for the expansion of our existing enrollment office. We're going to call that a welcome center. It's going to be quite a bit larger, more open space, much more welcoming for new veterans when they come into the healthcare system. That work's going to begin here in the next month or so. You'll also see some improvements in our lobby. We've got some carpet replacements that we're going to start on in Kerrville. And so a lot of things happening that are really going to improve the facade of the organization and the experience of both our staff and our veterans. But again, as we're preparing for expansion, we've got some new sites of care that we're planning as well. So some of you had the opportunity to join me in June for a groundbreaking that we had for the Northwest Healthcare Center. I'm really excited about this new project. This will be a 190,000 square foot ambulatory care center, about 2-year construction time frame, so we'll keep you up to date as that gets further along. The foundation is currently going in, and as we reach new milestones, I'll be certain to give you updates in my quarterly messages. But we have 2 more sites that I expect to be up in the next 3 to 4 months. One of those is going to be a new clinic for 5 primary care teams with the associated mental health staff. Now that'll be at 16103 Nacogdoches Road. And there's another site that'll be at 4522 Fredericksburg, also known as the Warnerland Mall. That's going to be dedicated to our mental health programs. As our veteran workload continues to expand, obviously as does our need for behavioral health services. So I know our mental health staff are excited about this new site. It's going to include some of our substance abuse programs, our PRRC programs, our PTSD program, as well as our CWT program. So again, we'll be doing some ribbon cuttings and keeping staff that will be impacted, and those that just may be interested in coming to take a look in the loop. We also, as a result of our continued expansion, as we get more veterans into the healthcare system, in the rare case that we can't provide the service that they need timely, we do have to use community care. That's where things like the Mission Act really come to our benefit and help us ensure that we can provide the care that veterans need when they need it. And so because of that growing workload, we have expanded our patient administration service. And in light of their FTE expansion, we've also secured a new lease for them. I expect this one to be open around January 2020. Again, we'll keep PAS and others that may be interested to come out and tour the space in the loop. But really excited about this project, and we look forward to its opening. Another connection I want to make to my 180-day plan and related to our expansion and space needs. One of the things that I prioritized when I came on board was re-looking at how we were using existing space and where we thought it was appropriate, moving non-clinical functions either to telework capacities or, if possible, off-campus. So those discussions are continuing. We have submitted a proposal for an expanded lease in the data point location, and the intent of that expanded lease is going to be to accommodate some of our medical administration administrative functions that are in the basement, to give a new suite to our corporate compliance office, and to accommodate some of the staff that are currently on the 3rd floor in quality safety value, and to move them there so that we can backfill behind those areas with clinical needs. So I'm very appreciative of the staff in MAS, compliance, and QSV who've been very welcoming as we've had these discussions, and look forward to recapturing that space for clinical needs. Now we have some large construction projects that are underway. The $10.4 million emergency room expansion project has been awarded. This for South Texas is going to create the emergency department of the future. This is a 4-phase construction project. The first phase of this one is actually going to be the construction of a new building. This is for human resources. It'll be located next to the current police building. So if you start to see that structure go up, that's what we're constructing there. And so that'll be phase 1. Then we'll move it into phase 2, which is going to allow for more renovation of the emergency department. So really excited about this one. I'm so impressed with what our emergency room has been able to handle in their existing footprint, but it is absolutely time to let those folks decompress. So look forward to that contract proceeding. I've got good news and bad news about our elevators. The good news is we awarded the contract for the elevator renovation. The not so good news is it's going to take a while for this project. Primarily, this is due to lead time requirements for some of the parts that we need to repair the elevators. So right now we're looking at approximately a year for this construction project. We're going to be doing everything we can to speed up the pace, but we want the construction to be done appropriately and to keep things safe. So I'll keep you up to date there. I absolutely appreciate the participation of staff who have been participating in the stairs campaign. I have lots of good conversations in the stairwells, and I look forward to us continuing to do that as the renovation of the elevators continue. So we also have an upgrade of our oncology unit and our oncology pharmacy. That contract was awarded. We're expecting about a year for that project as well. Again, really looking forward to seeing some improvements in that area of both facade and capacity. If you're wondering where I'm standing in our new bone marrow transplant unit here on the 7th floor. Many of you, obviously know that we are a bone marrow transplant center. This new unit has been under construction for quite some time. I'm excited to say we are nearing completion. There's some punch list items that are remaining. I was just talking to the leadership here in engineering. So look forward to having staff be able to move into this area by the time we reach January of 2020. So really exciting. We'll have a ribbon cutting, and we'd love to have staff here to see the new space. We also have some major air handler replacement projects underway here at the Audie Murphy campus. This is a 7-phase air handler replacement project, moving through floors, starting in the operating rooms. Some of you that have sent me speak to the directors with concerns about airflow, that's what our air handler projects are really intended to help us address. So I do appreciate your patience, but can assure you this is going to address many of those concerns. On our Kerrville campus, we also have a number of projects, from a water main replacement to some kitchen renovations in Building 96, some emergency power being installed, and some elevator replacement projects there as well. So a lot of things happening across the South Texas Veterans Healthcare System to ensure that we're modernizing. A few key staffing announcements that I did want to make. Adam Bernal, our now former Chief of Engineering, is now my new Assistant Director for Facilities, and I'm just overjoyed to have Adam on the team. He brings with him a wealth of knowledge. Adam is an Air Force veteran, and in this new capacity, not only is he going to supervise engineering service, but will also have senior leadership responsibility for safety, police, and information technology. Adam's effective date was September 29th, so he's already on the job, and we will begin to recruit his replacement as in engineering with a new chief. I also want to announce the selection of a new corporate compliance officer. This is a program I discussed with you as part of my 180-day plan. I'm pleased to announce that the selection that we've made is a gentleman by the name of Joshua Brown. Josh is currently the Chief of Social Work at VA Las Vegas, also an Air Force veteran, and I look forward to having Josh on the team. His current effective date is going to be October 13th, so he'll be on board very soon. I also want to remind everyone, October 1st, the South Texas Veterans Healthcare System became a smoke-free campus. This means no cigarettes, no cigars, no vaping of any kind on VA property. I really want to thank our staff for making this transition as smooth as it can be. If you have any concerns or you have any questions about our smoke-free changes, a lot of that information has already been posted on our intranet, so you can take a look at some of the links there, including some information for employees that may be dealing with smoking cessation. So if you need some assistance, you can get a lot of that information on our homepage, or you can reach out to occupational safety or our smoking cessation staff here on board. In closing, guys, I want to reemphasize that the South Texas Veterans Healthcare System is a really, really good healthcare system. But I know we can be great. I know we can be excellent. I'm committed to that, and I know you're committed to that. So we're going to continue to evolve as a healthcare system. We're going to continue to ensure that we're providing safe, effective, efficient, and compassionate care to the veterans that we have the privilege of caring for on a daily basis. I look forward to seeing you on my rounds. I look forward to seeing you in our safety forums. And I look forward to your questions via the Speak to the Director platform and filling you in on what's happening across the healthcare system. Thank you for choosing the Department of Veterans Affairs, and thank you for choosing the South Texas Veterans Healthcare System. Thank you.